So can you tell us what the Agency for Healthcare Research and Quality is?
Sure, it's one of the agencies that's part of the U.S. Department of Health and Human Services. Its mission is to improve the quality, safety, efficiency, and effectiveness of healthcare for all Americans. The agency is a research funding agency, and it's really focused on the healthcare delivery system and how to improve it.
What are examples of some types of projects that you fund?
I work specifically with the Health IT portfolio, which is just another word for program or initiative within the agency. So several of the projects we funded have developed health IT applications to try to improve care. That can include, for example, applications to help patients better manage conditions or help them with medication management, systems that help providers deliver evidence-based care using, for example, clinical decision support.
And have some of these programs been implemented?
Yes, at some of the settings that they've been funded. So the organizations that get funded, sometimes if the program shows good results, go ahead and incorporate it as part of their own information systems.
Have you seen any results from any of these implementations yet?
Yes, of course, and there have been some successes. The most well-known one is Project ECHO, which was out of New Mexico. It started as a telemedicine application to help treat patients with hepatitis and has been expanded to other conditions in other regions of the country and is now being funded by the Veterans Health Administration across the U.S.
So telemedicine in hepatitis, was this an app?
No, telemedicine intervention to help providers in rural areas have access to specialists that they would not otherwise have access to, as well as the patients to have access to those specialists.
I know telemedicine is definitely an up-and-coming field in a lot of different specialties, and sometimes they do video conferencing as well. Was that a part of this project?
I believe so, and so the idea was to give primary care providers in the rural areas access to specialists and consult them on specific cases and then help them treat their patients.
What do you look for in project proposals? Like, what would be a good project?
It honestly depends. It depends on the grant mechanism and the topic. I would say the better applications are the ones that can really articulate what need in the field they're going to be filling by doing the work and have really specified their methods clearly, have a clear rationale for how they're going to approach a project, as well as the team that they need to be able to do the work that they propose to do.
Are there any aspects of health IT that you feel like there's really a void and that your team is really looking for projects to tackle?
There are in a whole host of areas. I would say that health IT has been shown to improve outcomes in some settings but not others, so understanding what makes health IT work in some places and how we can take it from those places to other care delivery settings to make sure it works there as well. We need more work that looks at health outcomes. We found that health IT improves process outcomes quite a bit, but also health outcomes. We need more work looking at economic impact of health IT, and definitely more work on the consumer health IT realm.
Thank you for giving us your time today and for being here at MedX.
Thank you.